Welcome back to Portland Today. In today's Get Healthy, we are bringing attention to National Infertility Awareness Week. These are beautiful family pictures from Kelly and Carrie White, a local couple who struggled with infertility until their daughter Charlie was born. You see her there. Well, the family is joining us in studio, so welcome Carrie, Kelly, and Charlie.
Thank you. Thank you for having us.
Obviously you have a beautiful daughter. You have another on the way, so congratulations to you two.
Thank you.
Thank you so much.
Tell us about your journey a little bit. What did you go through to get to this point?
So we actually were with Charlie. We had to seek fertility treatment. So we went through intrauterine insemination in 2013.
Known as an IUI
yes.
to some people.
Yep. And we were successful with that, and we got Charlie. And then when we wanted to expand our family, we tried again for 6 more months after she was born. And it just wasn't happening. So we sought help again with Oregon Reproductive Medicine, and this time we did IVF, and we were successful.
And Carrie, what was it like as a family? It's tough to go through something like that. How did you two make it work?
Yeah, I mean, we just kind of leaned on each other and made sure that we were supportive of each other, going through this, through the whole process with the IUI, and we had done, kind of completed and failed a couple different times with the IUI and the IVF process. So we just had to stay, just kind of trust each other.
As a team.
As a team. We did it as a team for sure. And, it was successful in the end, but we just want to bring awareness, and we're blessed to have Charlie and blessed to kind of be creating another little one, another little girl, Wesley, on the way. So, we're just, you couldn't be more happy, and without Oregon Reproductive, none of this would be possible.
And the great doctors there,
Absolutely.
yeah. And Kelly, were you surprised when you find out so many people can relate to your story?
Absolutely, and there was a weird stigma when we first got pregnant with Charlie that like fertility or infertility wasn't talked about. And then going through it again with Wesley now, it's more, people are more aware of it.
Yeah.
And so that helped us through that process for sure.
Any advice to other couples who may be beginning their fertility journey?
I think just kind of stay the course. It's a windy road. There are bumps in the road. It's not just one of those you sign up for IVF and you're going to have a baby.
Right.
You kind of need to just trust the process and trust the doctors. Dr. Barbieri, Dr. Bankowski was unbelievable. Just the whole team over there at Oregon Reproductive Medicine. But trust the process for sure, because there are a couple bumps in the road. But stay positive, lean on each other, and lean on those who are around you for support.
What does Charlie think of having a little sister?
What do you think? What do you think of
Are
Wesley?
you excited?
Can't wait for Wesley. Huh?
She's so excited.
And Wesley will be her name. You're due in the summertime?
Yep, July 11th.
Wonderful.
Yep.
Well, you'll have your hands full soon with
Yes.
2 beautiful daughters.
Yeah.
Congratulations to both of you.
Thanks so much.
Now we're going to meet your very talented doctor who helped you get to this point. Kathy has more with Oregon Reproductive Medicine.
Yes, Ashley, I'm with Dr. Betsy Barbieri with ORM. And Doctor, this being Infertility Awareness Week, what do you most want couples to know?
I think it's really important to know that you are not alone in this process. As the Whites alluded to, as you start talking about it, more and more people come out and say, oh my gosh, I struggled as well. But when you initially realize something, a biological process of trying to have a baby that should come naturally isn't, you feel stigmatized or ashamed or frustrated, and it's actually way more common than we think. In fact, 1 out of 8 couples will struggle with infertility on their journey to have a child.
How many of those will seek help from somebody like yourself?
Probably not enough. And I say that because by the time couples come into us, several of them have been trying for years and are frustrated. And one thing that my colleagues and I always say is we wish the moment you have any questions, even before you're trying, you just start trying, or if it's been 6 months or definitely a year, come in. We'll never turn anyone away, and we'll just give you information to try and figure out why is it not working. Is there a simple fix that we can work with and tweak, or might you need more complex treatment? And if that's the case, we're going to hold your hand and help you get there.
Are there strategies that couples can try before seeking infertility treatments?
So prior to getting pregnant, I think it's wise to optimize your health. So for men and women, being kind of normal height and weight, best of your ability, have a healthy diet. Female can start a prenatal vitamin. Obviously, watch your alcohol intake. Studies have shown that drinking more than 4 alcoholic beverages per week can make it harder to get pregnant.
Male and female?
Both male and female. The sperm is surprisingly sensitive to environmental exposures. So alcohol use, cigarette use, obesity, marijuana can all impact sperm count. And those are simple interventions that you can do at home to try and make your...
Are hot tubs on that list like we've always heard?
Yeah, hot tubs. There's even concern about cell phone in the front pocket. So guys, put it in your back pocket.
Really? Oh, okay. Interesting stuff. You know, it's changed so much over the years. The success rate has really skyrocketed.
Yes.
What do you tell couples now when they come in as far as their chance for success?
So if couples have to utilize IVF or in vitro fertilization treatment, up until a woman who's probably 42, she can become quite successful, and the success rates can be up to 70% per one try, depending on the fact that if we can find a healthy embryo from that treatment process. So initially, you know, when IVF was first done, the success rates were we're in single digits. So we've really come a long way. And I'm really proud of the fact that we can offer those success rates, because it's hard to ask a couple or an individual to invest all that finances, emotion, time to go through this process with us, and we want to give them the best chance possible.
Not that you ever want to put a cost on something like this, but it can get very expensive for couples.
Yes.
Yeah.
Yes.
Dr. Betsy Barbieri from Oregon Reproductive Medicine, thanks so much for coming in. Rod, I know you have another health note for us.